All right, we are live. It is showtime. Let's start the show. Hello, everyone. Welcome back to Luncheon with the Experts, a Carcinoid Cancer Foundation and LACNets program brought to you by Ipsen Biopharmaceuticals. My name is Rain Bennett. I am your host this week and every week, and I'm a filmmaker and a writer, and I've been working with CCF and now LACNets, but CCF for 12 years, I think, going on 13. And in that decade plus, we've created hundreds of videos. I'm not even sure at this point. All different types of videos, patient documentaries, treatment-based videos, live video series like the one you'll watch today, but all with one singular mission in mind, and that is to spread awareness and education about neuroendocrine tumors. That is what we're here to do. Now, if you are new to this journey, if you are new to this show, I want to say welcome. And in my opinion, the value of the show, Luncheon with the Experts, is twofold. One, the information and guidance that you'll get from our guests, our guest experts that we have every episode. And two, the shared experiences, the shared stories, the support of the overall community within the show and the larger net community. It's extremely supportive. If you embrace it, I assure you the community will embrace you back. And one way you can do that very easily right now is to introduce yourself. Say hello. Tell everybody where you're signing on from. I personally always love to see how far the program reaches every episode all over the world, quite literally live. And that's fun for us to see. We really see how large this neuroendocrine tumor family community really is. And it's really helpful for all of us to be here together and share this information. Before we get started with the show today, we want to thank our sponsors, Ipsen Biopharmaceuticals, for their support. Couldn't do the show without them, but we always have this disclaimer from them that is important for you to hear, and that is that the opinions expressed by the guest presenters as well as the questions asked by the audience, that's you all at home, haven't been created or suggested ahead of time by the sponsors of Lunch with the Experts, and CCF and LACNets don't endorse or promote any of the views, opinions, or information provided in today's presentation. Now, here's the crux. Here's the takeaway. Audience members should not rely solely on the opinions or information expressed by the guest and should seek guidance and direction from their own medical advisors regarding any choices they make about their health or treatments. So all of that is saying is we're going to give you some good general advice, hopefully answer some of your questions and help you along this journey. But each case of this disease is unique, so take that information back to your home team, which knows your specific case, and make the best plan and path forward for you. Now, I'm excited about today's show because we have a first-timer on the show, not a first-timer to broadcast media, I just learned, but Sina Teskey, welcome to the show.
Thank you.
Yeah, appreciate you being here. Now, for those that aren't familiar with you, I know a lot of the LACNets crowd already is. This is our first time meeting, but I'm excited to talk to you because I get questions about your specialty every week, every episode. But for those that may not be familiar with what you do, tell us a little bit about your background, where you're from, and what role you fill in this net community.
Sure. So my name is Sina. I'm a clinical dietitian at a cancer center in Milwaukee, Wisconsin. It is actually sunny here today. Usually it's cold when I'm on these things and everybody else is somewhere warm. My hospital is called Frederick Hospital. I have been in a dietitian for 15-ish years. I stopped counting. And I've been in oncology most of my career. Through kind of the process of getting more specialized as I've been a dietitian longer, I now work mainly with surgical oncologists that work on GI tumors. And I work with one of our hematology oncology neuroendocrine tumor specialists, Dr. Fan, here as well. So we see a lot of neuroendocrine tumors. And over time, I've just been learning more and more and kind of found my way into the specialty. I also like to share because I know you guys are, a lot of you, some of you are providers, but some of you are patients or family members. And I also had an experience as a family member. My son, I have 3 kids, when he was 3 years old, was diagnosed with non-Hodgkin's lymphoma, went through treatment for like 6 months, lots of chemo, a lot of admissions. So I also can give you some tips and tricks from that perspective and just kind of the hardship piece of going through it as well. So professionally, oncology, personally as well.
Gotcha, gotcha. That's good to know. I don't know if you all noticed this. Can everybody hear me okay? Sina, you can let me know first, and everybody in
I
the
can hear
comments as
you.
well. I just had a strange thing happen with my microphone. It dropped out, so just want to make sure you could. I lost a little bit of what you said, but if everybody in the audience heard what you said, just let me know and say yes in the comments section so I make sure that you are taken care of. Um, I can handle it. Want to make sure you guys hear the content. So everybody at home, just if you are first time or not, I'll give you the best practices spiel, and the best way for us to answer these questions, at least for me, is to kind of formulate your questions in generic terms. We don't know your specific case. I think sometimes people try to add details for clarity, and sometimes it gets a little confusing or it's just too much, too specific. If we need more information about your case, we'll absolutely ask it. There's no limit to questions you can ask, so you can just ask them in little chunks and continue to ask follow-up questions as the episode goes on. And if we don't get to all your questions, you can always email us or reach out to us. One of the great products that came out of the LACNets and CCF merger was the support line, which you can find at lacnets.org/support line. And you can see that in the links already. We will try to add links to any references that we discussed today in that comment section so that you can easily find them and don't have to go open a internet browser and Google it real quick, and you can just stay focused on the show. So, Sina, I
Yep.
am going to be selfish and ask the first question.
Great.
There's a lot of, I don't want to say different takes, but there's a lot of things to consider when it comes to nutrition, especially for NET patients. I'd say for cancer patients in general, but certainly NET patients.
Hmm.
And maybe some inconsistencies, or it depends on each patient. But I always like to think of the new patient, newly diagnosed patient, and sometimes they're here in the show, they might have been diagnosed last week. So let's start very fundamental and lay some groundwork. What are if you had a newly diagnosed patient last week and they come to you and they're like, what do I do, what can I eat, what can I not eat? Let's just start with the foundation of how this impacts your intake and what
Hmm.
you can consume.
Yeah. I would say my first question back when I get asked that is, how are your bowels? Because it really will make a difference, right? If you're having diarrhea, the recommendations change. And I'm sure we'll go into that because that's a huge piece of neuroendocrine tumors. Because then it's like, what type of diarrhea? And within that, there's stages of what to eat. So let's pretend newly diagnosed, no issues with bowels at the moment. What would you eat? Um, Most importantly is making sure we get really good sources of protein in our diet. It's great for your immune system, for healing, for keeping up muscle strength. Lots of different ways to get protein. You can get it from plant-based protein items like beans, nuts, quinoa. Dairy items would be the next section. You could do like cottage cheese, Greek yogurt, high protein milks. Then there's meats and fish, chicken, fish, turkey, and then there's protein drinks. So people ask a lot about protein drinks. I am an advocate of them. I think extra protein can be beneficial unless a person really has some issues with their kidneys. Otherwise, the protein is great for you. So that's where I start. From there, I would say really important if you're about to get treated for a neuroendocrine tumor that you're maintaining your weight. Kind of a contraindication, or not contraindication, something that we're trying to prevent for all of our patients is malnutrition. Because when our body's malnourished, it's not functioning as as well. And we want high functioning, quick turnover of healing. And malnutrition can come from muscle loss, from losing weight. So if we can get patients to eat enough, maintain their weight, and get protein, those are like kind of three, I would say, general eating for anybody with cancer. Within neuroendocrine tumors, I would say I usually recommend like small, frequent meals more often than other cancers. The smaller the meal we have, the less hormones that are secreted at a meal as we digest, and the less issues or flare ups we could have of diarrhea.
You mentioned protein drinks, and I still am active and an athlete, but
Yeah.
I was in the fitness space for a long time, so I'm well aware of the ever increasing number of products in that
Yeah.
category. Where do you start in determining like what's, I know this is very vague, what's
Yep.
good and
Yep.
what's not, because there's a lot of things that aren't necessarily out there on the shelves.
Yeah, I kind of break down protein drinks into a few different categories. We have whey protein drinks and we have pea plant protein drinks. That's generalizing, but those are the two types of protein. Often whey protein has a higher quantity of protein. It's usually a serving is 30 grams or less, but up to 30. Pea plant protein, I would say I've seen max out at like 20, 25 per serving. From my perspective, no preference or difference is what you tolerate better is fine. And they do have a different taste. I tell my patients to try both. Within that, a lot of nutrition is personal values as well. So I have some patients that only want an organic one. I have some that don't want corn in it. I have some that just want it for the protein. So kind of like food, like some people choose to buy organic and some people don't buy organic, very similar. What I tell people is when you're thinking about protein drinks, what is the goal? If you're losing weight, you don't want to drink the category of protein drinks that are like 150 calories. And Rain, I'm going to assume this, but a lot of people that are working out and like trying to eat healthy and get more muscle, that's what we would recommend because we're telling them they're doing it as a protein addition. Mm-hmm. But if you're going to use that as like a meal replacement, 150 calories isn't a meal. So there's a big kind of category of those like Premier Protein's popular, Muscle Milk, Ensure Max, Fairlife Core. Those are some of those low calorie ones that are made with whey protein. Then the next category is kind of like 200 to 300 calories. Those can be great as like a snack or a small meal for somebody. And then there's kind of like the big bang for your buck ones that are really high in calories that are kind of a meal replacement. I mean, Boost very high calories, like 530 calories. Then there's like I'm thinking of more of the common brands out there. There's like Ensure Complete that has 350 calories. There's like Orgain products that have in the 200 calories. There's Kate Farms that have in the 400. I think they're 455 calories. So there are thousands of protein powders on the market. What I tell people to look for is if you're going to drink one, you want at least 20 grams of protein in a serving. And then next, think about, do you need it just for the protein? Then don't worry how many calories, or are you eating this also, drinking this because you're not getting enough calories? Then you want more than 250 calories.
Gotcha. And what are some of the things that are typically no-goes for a neck cancer patient, if there is some consistent through line there?
I am a big person that doesn't like to say you can never eat something again because I just think then you're going to want it. And everything's in moderation, right? Mm-hmm. So within cancers, sugar is a big concern for people. And I like to break that down a lot. Can I break it down for you guys? Is that
absolutely? I've got questions about it if you don't. So yeah, absolutely. Take the mic.
Okay. So sugar is a glucose source for our body. Just to start from like scratch, sugar has no nutritional value for our body. We do not need it to survive. But if we eat it, it does become a glucose and an energy source. So it tells our cells to have energy. So either work their normal function or divide and spread more. So a lot of hype around the number one question we get is, does sugar feed cancer? And a lot of that became because people have to drink glucose before they get a PET scan to light it up, because glucose is quick energy. So when you think of a marathon runner who, mid-run needs more energy, they're not going to eat something that is like high in fiber and takes a long time to get the energy broken down. They eat like Skittles, straight glucose packets, sugar, because they need to eat it and have it work right away. So I like to try to take the fear away from sugar. We do not need sugar in our diet. There's no nutritional value to sugar, but sugar, also being said, I wouldn't like tell you to eat a cookie and then a brownie and then have a milkshake every day. Eat a healthy dinner and you feel like having after dinner, you shouldn't have fear of that. Thing is, sugar, when it's consumed with other nutrients, so with protein or fiber or fat, those three digest slower. So it's not like our body gets this as big of a blood sugar peak. When we see our blood sugars peak, that's when we see more like cell division and storage of extra calories. But our body, I kind of try to think of like as it's breaking things down, it takes a little bit longer to do that with fiber. So sugar in terms of those types of food isn't that direct hit like it would be if you were eating Skittles running a marathon.
Got it.
So
Got it.
again, I say, do you need sugar? No, but don't feel like you could never touch something with sugar in it again.
Yeah, yeah. No, I'm glad you addressed that because this concept of the sugar feeding the cancer is absolutely, a question we get a lot of too, and you
Yeah.
hear that conversation going on a lot. So I'm glad we talked about that. Folks, if you joined us a little bit late, this is Luncheon with the Experts, a Carcinoid Cancer Foundation and LACNet's program. Today we are here with registered dietitian Sina Teskey, and we were talking about all things. She is a specialist in GI and neuroendocrine cancers. We were talking about all things nutrition and diet and food, and all of these questions that I see coming from you all often that sometimes our medical experts aren't necessarily educated in. We've had nutritionists on the show before and talked about it. Send in your questions. We're going to get to as many of them as we can today. I have a question that comes in from Melissa. Melissa says, well, I'm mostly concerned about poor nutrition absorption due to fast moving stool.
Hmm.
Parentheses, no ICV, no gallbladder. Are there things I can change within my diet to assist with that, either to slow or
Hmm.
make absorption easier?
Yep. Great question. Um, there are things that can speed up. Let's talk about what maybe to limit or avoid that would speed it up and what we could try adding that could slow it down. Um, Spicy foods would speed up how quickly you were absorbing or how lack thereof absorbing. Um, I would say, depending on the type of diarrhea you have, it could be foods rich in amines, which we can talk more about. And high fat foods can also increase the how quickly you have rapid transit, and then foods really high in sugar can also increase transit. So spicy, high fat, sugar, and then possibly foods rich in amines. I'll come back to that one, the amines one. Foods that could slow it down would be soluble fiber. So we can go through kind of the difference of the soluble fiber versus insoluble fiber. Do you want me to go through the amines first? Because this is kind of
I,
like a very good question, but there's a few layers to it.
right. I think let's go through the amines first
Okay.
because that's also something that comes up frequently. And then absolutely let's go right into the soluble and
Sure.
insoluble. Yep.
Okay. So amines come up for neuroendocrine tumors because these types of foods can cause more secretion of hormones, and a lot of diarrhea with neuroendocrine tumors is from too much serotonin or hormonal secretion causing that diarrhea. So amine-rich foods would be like fermented foods, like sauerkraut, aged cheeses. Soy-based things, so like miso, tofu, um, there's kind of a breakdown. You can do high or like medium within that. It would also be like carbonated products, Brazil nuts, peanuts or peanut butter would be on the list. um, like some of the processed meats like salami or sausage as well would be amine rich foods. So we do recommend when people come to us, and the main thing I see with the doctor, I see the patients for diarrhea. We work with diet. There's like kind of stages we go through, but this is something I always from the beginning say, keep your eye on these foods. Bananas are on the list too, and raspberries. And you can find these lists of amine rich foods for sure. And I can also give one to Rain later, but keep an eye on like what if these foods are triggering your diarrhea to be worse. I do recommend keeping like a journal for a little bit if your diarrhea is pretty bad, to kind of go back and star the meals where you had really urgent or more diarrhea after or more in the middle of the night, because then you can kind of look back and see if there's a trend. So that's amine foods. Fiber. So I was just telling Rain, there's two different types of fiber. We should talk about fiber today, because fiber is really healthy for your gut if your gut is healthy. But when your gut is not always healthy, fiber is not always a healthy choice for it, because basically fiber makes your gut work harder. I work a lot with people that are post-operatively from a GI surgery, and my example I give them is, you had this surgery, you have new areas that are stitched together, which is kind of like having a little cut on your arm. eating fiber is just like kind of scratching it throughout the day. I mean, your cut's going to heal. It's just going to take a little longer because it's working. I picture fiber kind of going back and forth in your gut, and it, in a good way, stimulates a lot of good things for a healthy gut. But fiber, there's insoluble fiber and there's soluble fiber. So insoluble fiber are like the skins, seed. I kind of consider it like the roughage, nuts,
Yeah.
seeds, a lot of vegetables and fruit because it's the skin of it. So I think of an apple. The skin of the apple is insoluble fiber. The inside is soluble fiber. So insoluble fiber with inflammation or diarrhea can actually almost overwhelm your gut and make you have more diarrhea. So like the skin. So sometimes my patients with really bad diarrhea will peel an apple. Soluble fiber can actually help bulk your stool. So that would be if you peel the pear, apple, peach, it'd be the inside. It's a banana. It's a potato. So it's kind of like the not skins and seeds part of the fiber. So soluble fiber can help slow down diarrhea.
Got it. Got it. Thank you.
Can I go back to sugar and say one more thing while you look at the
Yeah,
question?
yeah, yeah,
Okay.
absolutely.
I should have mentioned too is like we can't starve a cancer cell without starving a healthy cell. So if your body is not giving it sugar, it's just going to use something else. So again, limiting sugar, I would tell everybody that's healthy to do, but you can't necessarily starve a cancer cell without starving yourself. So you do have to nourish your healthy. I tell my patients, focus on your healthy cells, nourish those cells to fight with a good
Yeah.
fight, right?
Yeah, and that, I mean that's a common misconception I believe too. This whole like starving it
Yeah.
concept. What are your what's your experience with lung nets? Is the question coming from Robin? Does this
Okay.
nutritional advice apply to lung nets? And there's a lot of separation in um, nets of the GI
Yep.
and lung nets anyway.
Yep.
I don't know if you deal with lung nets at all, but where does it overlap, if at all? Are you experienced
Yep.
with that? Yeah.
Yep. Lung nuts are kind of nutritionally a little bit more similar to like another type of lung cancer, where the goals would be good protein, healthy eating, maintaining your weight, and without the concern for that over secretion of your gut.
Got it. Thanks, Robin. Let me know if you have any follow up questions as well. Wendy says, Lanreotide has helped my diarrhea tremendously, but for 2 days after I get the shot, it's bad again. Is there any way that I can prepare better for this reaction?
Wendy, that is a great question, and it's a real thing because Lanreotide helps with diarrhea significantly. But one of the side effects right after you get it is a decreased pancreatic enzyme production. So people can have like temporary for maybe you said 2 days, I think. I have some patients that say a week. They have oily, greasy, fatty stools, which we call steatorrhea. We actually in our clinics will give people Creon or a Zenpep or pancreatic enzymes that they can take for those 2 days after surgery. So I would anticipate the diarrhea is happening when you're eating foods that are higher in fat. So another thing you could do for those 2 days is eat less fat. So when we eat fat, our pancreas secretes amylase and lipase, which digest the fat. But if our pancreas isn't secreting enough of those enzymes, we get diarrhea. The symptoms of that kind of diarrhea are urgency to go, lighter colored stools, floating stools, grease or oil, like looks like someone actually dripped oil into the stool, very foul smell, or just even increased gas and discomfort. So if you wanted to fix that with diet alone, just go to a low fat diet for those 2 days because less fat, less need for those enzymes. Or go back and ask your provider, hey, is it something that I could get some pancreatic enzymes on a smaller dose of it just to use as needed after my Lanreotide shot?
Got it. Hey, thanks, Wendy. I've got a question from Cynthia coming
Yeah.
over from YouTube. Hey, Cynthia. Wow, doctors recommended over the counter fiber while I was in the hospital. Are supplements like Metamucil soluble or insoluble fiber or both?
Yeah, that's a great question. I think it's a combo. I actually don't fully. Metamucil and Citracel have two different fibers in them. One of them psyllium. One of them is a different. I'd have to look up which is which. But those work a little bit differently, the powdered fibers, because the actual breaking up of the roughage of the skins of things is done, right? It's a powdered form that you mix into things, Citrusol and Metamucil. We even have some patients that use Metamucil right after surgery, even on a low fiber diet. So that does function different than the food. The actual breakdown of how much of what insoluble versus soluble, I don't know off the top of my head.
One of the documentaries that I did for CCF was on a net patient that was doing everything to give herself the best shot. So very holistic approach in conjunction with the medical treatment that she was receiving. And one of the things that she did was a vitamin C infusion periodically. I'm not sure how often or how frequently. What are your thoughts on something like that? I wasn't super familiar with it
Yeah.
when I filmed it.
There's actually a study. There's one of our studies here currently that is using vitamin C infusion. I think that a little bit more research has to be done before I feel like great about telling people to do it, because the current recommendation, if you're going through, now not everybody with the neuroendocrine tumor is going through active treatment, like getting
Right.
like chemotherapy, let's call it, or surgery. Vitamin C is an antioxidant, and we do not recommend people taking supplements of antioxidants during active treatment, because it's actually an antioxidant protects the cell. Vitamin C is protecting your cells, and then we're giving you drugs to break down the cell. So it's not recommended to give. So we tell people they can take vitamin C otherwise, like not during active treatment. But the IV version of it, I do think there's a few studies going on right now that'll give us a little bit more information on the effectiveness of it. But currently, I would not say there's enough out there to say to do it. I know some clinics have a little bit more work with that than maybe where we're at. I don't have any neuroendocrine tumor patients currently that have told me they're doing that or that we've recommended it for.
Gotcha. Yeah, I was super curious about that. Vicky says, "Is eating food with gluten a contributor?"
Gluten gets a lot of harp, right? Because a lot of people are intolerant to gluten. Let's start there. But it's not necessarily the issue for neuroendocrine tumor specifically. It would only be the issue if you actually had a gluten intolerance. I know some people do like an elimination diet for a little bit to see if that makes a difference for them. For sure, gluten and dairy can be two easy things to trial taking out of your diet and seeing if you feel better. Because as a whole in America, those are two things that we have more intolerance to that can cause diarrhea. So lactose intolerance, as we get older, we produce less of the enzyme to break down lactose. And gluten intolerance is more commonly seen these days. So for sure, you could try it. But specifically for neuroendocrine tumors, it's not, unless you had a sensitivity to it, it's not the issue.
Got it. Thank you. Sasheen says, it is known is it known rather, what causes the shortness of breath after eating in carcinoid syndrome? Say someone has the triad, flushing, diarrhea, and
Yep.
shortness of breath. Are there certain foods more likely to cause that shortness of breath?
My guess would be it'd be more the foods, again, the amines that are also relating to the hormonal secretion. That's going to make the biggest difference in diet. Not that it's caused by diet, but that maybe not having them would limit the severity of the symptom.
Got it. Thanks for your question. Let me know if you have any more. Dun-dun-dun. Dana says, my husband is a net patient going on 3 years. He's stable, gets monthly lanreotide injection. One thing I have noticed is that he intensely craves sugars and sweets, but then starts to have stomach aches and feels yucky after eating them. Is there a way to help curb those sweet cravings?
Yeah. Salt and sweet are two things that are acquired taste. So the more we have them, the more we kind of crave them. But that being said, sometimes cravings of sweets or sugar, again, that's glucose and quick energy. Sometimes we crave that when our body's really hungry because it's really looking for energy. So I would say it might be interesting to record what it was your husband, I think, eats for a day. Make sure he gets enough protein and calories. I wonder if after his injection, if he's maybe napping more tired, or just that injection is increasing his metabolic rate and he's needing more calories. I would suggest trying to add in more calories and make sure he gets enough protein in those days to help with that. Also, Whether you choose an organic, a natural one, or a whey or a pea, protein drinks are often sweetened so that they cover up the taste of the vitamins in it. So that can be a way for him to get the taste of sweets without all the sugar and maybe not feel as sick.
That's a good point. Good point. Thanks, Dana. Robin, the lung net patient who asked a question earlier, had a
Yes.
follow up. Thank you. Very interesting to follow other lung cancer nutritional protocols. The question is that because it seldom causes carcinoid syndrome like GI
Yeah.
to do?
Yeah. Cancer as a whole, in terms of nutrition, has a strong base that probably covers most patients. And then within the 20% of specific cancers that have symptoms that are more nutrition related, it kind of changes a little bit more, like pancreatic, breast has a few, so lung, the patients that we see with lung adenocarcinoma or neuroendocrine tumor for carcinoma, the biggest things that we're working on are just general healthy eating, maintaining that good weight, getting enough protein. And then symptomatically, if like Robin was experiencing a symptom from treatment or from her type of cancer, we would, adjust based on that specific symptom. But like as a whole, there wouldn't be a whole change. The American Institute of Cancer Research has great recommendations for cancer prevention and having cancer and not exacerbating issues. So within that some of them would be limiting red meat and processed meat to 12 to 18 ounces per week. So that is research based. The American Institute of Cancer Research has said that for years. They recommend eating more omega-3s, eating more fiber, maintaining a good weight, getting 20 minutes of walking in every day, or they say 150 minutes of moderate exercise or 75 of vigorous exercise. So a lot of that general stuff is kind of across the board for nutrition.
Got it. I'm wondering, is there you kind of were alluding to it with the amount of red meat. Is there a normal is not the right word, a typical ratio of macros for a net patient in terms of like high protein, moderate carbs, or
Yeah.
does it vary wildly depending on,
Yeah.
the patient?
It really varies because your carb intake in terms of macros, your carb and your fat would have changed per person. Somebody needing a ton of pancreatic enzymes, probably we wouldn't give them as much fat as somebody who doesn't. Carbohydrates, again, are great if you're needing high calorie. Protein across the board, I mean, people are very different, but it's based on your weight as well. These are, if you really wanted, I should say I don't in my practice, and the dietitians I work with, there's 6 of us in the cancer center, only outpatient here. We don't do like macro breakdowns on how to eat. We usually will do protein and calories, because within that, there's enough to worry about with a diagnosis of any kind that I don't ever want nutrition to become the stressor.
And this is a big question.
Yep.
What are your general thoughts, and we can get specific if you want to, about supplements? Again, I know that's kind of a huge.
Vitamins or like herbals?
Let's start with herbals. Just yeah, and just in terms of the approach, if there are some that are better than
Yeah.
others, or recommended or not. But I know that we get these types of questions too. I don't know that it's necessarily a replacement for medication, but hopefully just a complement and not a supplement.
Yeah. Okay, there's a few kind of things that have been more researched.
Okay.
So turmeric is an anti-inflammatory supplement people can take. Again, I do not want to tell people to take things without talking to their team, because some of this can be affected if you're going to have surgery. They wouldn't want you to take certain things, and it can counter interact with another medicine. But things that have been researched would be turmeric, fish oil or omega-3s. Those are the 2 big ones: anti-inflammatory, antioxidant. Then there's like a whole slew of them that people can try. We always recommend going through a pharmacist to cross-check your medications for those. A lot of herbals are not regulated by the FDA, so you just don't even know what's in them. So I don't, in my practice, recommend like them currently. Not saying there isn't more information. We're definitely
Sure.
seeing there's some like bile acid supplements online, and I've seen some other things that I've kind of looked into. Vitamin mineral, great question. Yes, we do use supplementation for that.
Okay.
Based on, I can see one of the questions in here about vitamin D and B12. Like those are low nutrients for that diagnosis because of the way digestion goes. So for us to absorb vitamin B12, we need a specific enzyme called intrinsic factor that is secreted into your gut to absorb it. So if you've had surgeries or different connections in your GI tract, you might not have that secretion of the enzyme going in as well. And vitamin D is absorbed with fat. So if you're not absorbing fat right, you're probably not absorbing all your vitamin D. Or like me, you live somewhere that's in the northern hemisphere of America, and we just don't have strong enough UV rays in the winter. So like we check vitamin labs. So I don't like to just tell people to take it without knowing what their baseline is.
Got it. Got it. Yeah, great question, Jason. Right on time. Sina, what can we get real for a second?
Sure, let's do it.
I feel like you can keep it real. What is a misconception out there in your space that frustrates you, that you hear all the time, that people get wrong? I don't want to say wrong, but you know that.
Sugar.
Yeah.
People like to come up to me and tell me like I eat no sugar, and it's not that I'm not proud of like people eating really healthy. I have 3 kids, like I limit their sugar and I try to eat healthy and more fiber, but I just feel like we worry so much about like what not to do. Like why don't we talk about what we should be doing, right? Like if you don't have a lot of issues with diarrhea, like you need fiber, like eat more fruits and vegetables. We don't need to worry about all the extra things we can do. Let's just eat real food. It's probably my biggest misconception. There's been a little like more chitter chatter about some like keto diets and fasting. And the good news is there's like great research coming out about fasting. Like they're actually looking into the research of it, which I like. I like to be evidence-based. That kind of stuff doesn't bother me though, because it's, if you get a diagnosis, you look up everything. And sadly, Google tells you anything you want to hear.
That's my quotable for today.
Google.
So true. Yeah, it does tell you. Yeah, whatever you're looking for, you'll find it there.
You can ask the same question and get the yes and the no, right?
Absolutely.
So it's like,
that's why it's so important to actually, I mean, this is so cliche to say do your research now, but to know the sources, right? To actually know the sources because most people do when they're trying to argue any point. I know we're digressing a little bit, and Jason says, and what we don't want to hear.
Yeah.
You just Google the first thing that comes up from your specific biased Google search. You're like, oh, I told you.
I know. And honestly, I guess the reason I say sugar, because again, I advocate healthy eating, is I have patients that are losing a ton of weight and their family's like, well, they can't eat sugar. And I'm thinking, if like all that sounds good for dinner is an ice cream sundae and it's eating that or eating nothing, their body actually needs the ice cream sundae. That they're not even getting extra calories to cause cell division. That's just the calories to keep their body moving. So you kind of got to weigh out the situation. Nutrition is not an everyday, all the time. This is the right answer.
Kind of a big picture question along this train of thought. A lot of even the oncologists and surgeons that we talk to, everybody in this space, most everybody that I've talked to is very focused on and prioritizes quality of life in this space. I really love that. It comes up all the time. It's very important to the medical experts here. In terms of what you do with NET patients and any cancer patients, what types of things should they be focused on? Again, I know it's a little bit vague, but where should their mentality be? That's kind of what I'm driving at, because it can be frustrating. What you eat one day might not work with you the next day.
Yeah.
I always like to advocate for the patients because I know it gets frustrating at times. How do we help them with that?
Yeah. So like a little background about me, I actually worked for 2 years in an outpatient eating disorder clinic. So I have a very, my mindset is like nutrition should never be stressful. A neuroendocrine tumor is not that. But when people worry so much about what they're taking in and the stress of eating becomes similar to a person with an eating disorder, that they just feel they can't eat anything. That's what we want to take away. Now, people that are having really bad diarrhea, like we do need to work with, like they should see a dietitian to break this down, because that is quality of life. I would be nervous to eat what to eat with that too, because you're trying to figure it out. But if you're not having those symptoms, you know, it's okay that like you're at a kid's, it's my daughter's birthday today. We're going to have cake. And that's okay, right? It's her birthday. Happy birthday. You live to be 12. We say that all the time in our house. My son is a survivor, and we are lucky to have every year we have.
That's awesome. I love that.
Yeah.
Folks keep sending in those questions,
Yep.
so I don't
I'm
take them
ready.
all, but I get really passionate about this topic too.
Sounds
So
good.
I'm so glad to have you here. Robin says, "Do you have a recommendation on time allowance between meals and the last meal of the day and going to bed?"
Yeah. I think a lot is coming out about this in terms of fasting and like the blood sugar surge, so to say. I don't think eating something before, like within an hour of going to bed, is a big deal if it's not all carbohydrates. So, like a protein or like some almonds, like a fat, would be okay for that situation. If you're a person with carcinoid syndrome having that kind of that watery or diarrhea in the middle of the night, I would suggest to not eat as close to bedtime. Maybe maybe you eat dinner at 6 and go to bed at 9. But if not, I would just say a snack's okay at night, but really a lot of carbs before bed probably wouldn't be my number one snack.
Got you. Where are you spending most of your time and energy these days? Is there a certain topic that you're really focused on in 2024?
Well, my 2023 goal was just to focus more on neuroendocrine tumor research. So I went to like the national conference up in Montreal and did a bunch of that. Honestly, I'm just always trying to get more collaboration with GI. And so this year we're kind of working more with them on medications, like the use of medications within GI issues.
Got it. Got it.
Imodium, Lamoda, like some over the counter, Gas X, just all that, like how we're recommending it and how it's working for patients.
Gotcha. Thanks. Okay, next question comes from Rhonda. We talked about weight loss before. Rhonda says weight has been a lifetime battle. What is the best diet regarding weight loss?
To lose weight, wanting to lose weight, or because you're losing weight and you don't want to be losing weight, like unintentional
Weight
weight
has
loss.
been a lifetime battle.
I can't see the question.
My take is it is to encourage weight loss. But Rhonda, let me know if I'm accurate with that. We've got some other questions we'll take in the meantime, but
Okay.
send us back a comment there, Rhonda, and just clarify that a little bit. Amna says, "What is the best way to get hydration? Plain water sometimes causes me to be nauseated."
Yeah, that is such a good question. I told Rain that we should talk about hydration
Yeah,
today
definitely do.
because there's so many electrolyte drinks on the market, but some of them within an electrolyte, we kind of talk about the osmolarity. So how close it is to how easy it is for our body basically to digest without issues. And not all of those are, the osmolality can be high or the sugar can be high and it can cause issues too. So first of all, if water causes issues and it's because of taste, I know that wasn't your question, but for some people you can like infuse with things, cucumber, lemon, orange into your, like a pitcher of water in the fridge. I'm a huge fan of that. Rosemary.
Totally.
Um,
Ooh.
but if it's causing discomfort, I think she said bloating. My total feed of the questions I can't see anymore, but I
She
would,
said nausea, just to be specific. Yeah.
yeah. So two things: you can get hydration from foods that are high in water too. So like a broth might work better, watermelon, a popsicle, something like that. The other thing is some of the electrolyte drinks that have a close, I wrote down a few for you guys, that have a close osmolarity that are easier for absorption. So some people have heard of Noon, Nuun. It's a tab that you put into water. Noon Performance is one. Pedialyte, Drip Drop is another one. Otherwise, if you're a Gatorade drinker, we would say mix 2 cups of Gatorade with 2 cups of water and half a teaspoon of salt. That would be a rehydration solution with an osmolarity that's not going to cause diarrhea. The nausea, though, I would say if you're drinking a lot of fluid with the meal, the other thing would be to separate fluid from your meal because it might just be too much in your stomach at once. And then try some like soups and other ways to get hydration, tea, so that you're not. Oh, I mean, we need a lot of water today. You're not only having to drink water and nauseous all day. If that doesn't improve, I would talk to your provider about other ways to manage your nausea.
You beat me. I was gonna make a joke, and you beat me to it. I was gonna say, so just drink regular Gatorade. It's fine, right?
Yeah.
Just full of sugar. If you ever look at that label, they are trying to do better. There's like a Pedialyte style version of Gatorade now. It's still got
Yeah.
some sugar in it,
I
but
love when my kids want it for like soccer, and I'm like, this was made for like football players that sweat in Florida for hours.
yeah,
You
for
are going to
4 hours.
go for 20 minutes. You don't need it.
Yeah, I had to have that same conversation with my kids. When they tasted it, and it was like, "Ooh,
I want that.
we had to phase that out of the
Yep.
cabinet." Okay, so heard back from Rhonda as
Yep.
well as Cynthia from YouTube. Yeah, encouraging weight loss. So that
Okay. That's what I thought, but it's kind
me
of two
too. Yeah.
different
Just
topics.
want to be better to be sure.
Yeah. Yeah. Sometimes with certain medications that you take with diagnoses, weight loss can be a lot harder. It just changes the metabolism of how we're working. But I am a big advocate of using a food tracker online. There's different ways you can track it. There's one called like Calorie, Calory. There's like a My Plate one. There's um, what's the biggest one that like Under Armour has? I'm blanking on the name of it right now. If you Google food trackers in your app, it's huge because you can see where your calories are coming from. Are you nibbling too much? Are your portions too big? Did your calories at your meal? It really becomes, if you want to lose weight, calories in need to be less than calories out. So you either need to try some more movement or really try cutting back on the calories total. The easiest way to do that is to watch your portion of your carbs
Yeah,
and keep your protein high.
yeah,
But definitely track your food, even if it's just a few days. It is proven that you will lose more weight if you track your food because you're keeping yourself accountable. You're going to go take a bite of something. You're like, oh, I got to write it down. Then I'm not going to do it.
yeah, and like and the density of calories in certain foods too.
Mm-hmm.
I had to. I like salty as kind of my fix, and so I would always have not the sweet trail mix with a bunch of stuff in it,
Yeah.
but almonds and things like that. But you eat 2,000 calories of almonds snacking throughout the day. It's not necessarily healthy, so I had to just stop that.
Agreed.
Yeah. Okay, we got a couple comments about the hydration, a couple of people adding their experience as well, which is great. And Sasheen, yeah, we were talking about, or I was talking about Gatorade Zero, which is a little bit better. It's more specifically a targeting that, like the electrolytes, I believe.
Some have sugar alcohols in them. Just beware if you have diarrhea, sugar alcohols can get worse with that.
They are not perfect by any means. Let's talk about iron. Got Eltaz. Eltaz. Let me know if I'm pronouncing that correctly. I have a GI small bowel net. I'm getting low in iron. Is spinach and meat, i.e., beef, okay to consume in a moderate amount?
Yes. 12 to 16 ounces of red meat a week, which I think is a portion of meat that they call portions the size of a deck of cards. It's 3 to 4 ounces, right? So
Right.
that's like 4 of those a week. And iron, the highest amounts of iron and absorbable iron is in red meat. If you have something rich in vitamin C, like an orange or a little bit of orange juice or grapefruit with the red meat, the absorption of iron is increased with vitamin C. The absorption of iron slows down when you eat something rich in calcium with it. So don't have a glass of milk with the steak if you're trying to get more iron.
Oh, interesting.
Yeah.
What are
Iron
others?
is fortified in a lot of grains too. It's like hot cereals fortified in iron. A lot of cereals are fortified in iron. So iron's a little bit easier to get now from non-meat sources as well.
Nice. Great question. Thank you for your comment. I don't think I've seen you here before, so welcome to the show if it is your first time. Sina, earlier I asked you where you were, focused
Yep.
this year. What area in this space would you like to see more research done? Where would you like to see more activity exploring?
I think pancreatic enzyme replacement dosing and comparison of products.
Can you elaborate a little bit for
Yeah.
me for
I
them?
don't know if anybody here takes pancreatic enzymes like creons, MPEM, pancrease. They can be dosed from like a 3,000. So those are the enzymes that help you digest fat that you would take with each bite of food, with each meal. But the pills start at a 3,000 dose, which is more for a kid. Most adults start at like 24,000. And the pills now go up to like 60,000 enzymes per capful. But then you can take multiple capfuls with the meal. And I find a lot of it right now is a little bit of trial and error to find the right amount that people need. I would love for there to be a better way to get to that final dosage easier. But we don't eat the same amount of fat in every meal. So this study would have a lot of variables.
Yeah. Folks, I believe there was someone who mentioned Creon earlier, and if I missed that question, I'm sorry. But if you're still there and I am accurate with my memory, chime back in for me. Let me know. Oh, this was a question I was actually going to ask from Mandy. Can you recommend any books to read regarding nutrition for NET patients, or is there a handbook or a NET nutrition Bible?
I wish there was one. Maybe we should write one.
You should.
I will say what I really like, and I have
Yeah.
it here with me just in case people knew about it. So the company that makes a medication called Zermello that people can take if they're on an somatostatin analog for over 3 months and still having diarrhea, they can take Zermello. It's another way to help decrease hormones to help with secretory diarrhea. But they make this book, and I've met the reps at some conferences, so I really like. It's not like a textbook, a reading book, but it's a cookbook.
Find the food you love.
Find the food you love.
Love that.
The thing is, I don't know if it's like available to everybody or just people that take the product, but it talks through like it has I think it's beautiful for patients. It has a page that goes through each type of diarrhea you might have, why the symptoms of that type of, because we talk a lot with patients about, let's figure out the type of diarrhea you're having before we can figure out how to help you. And then it talks about all these different fiber versus, different types of fiber, and then it has recipes. But textbook, like reading book, let me ask our neuroendocrine tumor expert doctor if she has a book she recommends.
Yeah, great. That's always something. Who asked that question? Mandy. That's always something you can follow up with us about too. We'll try to get you the answer to that question. But great question. Thank you. Melissa says, can you recommend, or would you recommend rather, cholestyramine to help slow BMs?
If you have bile acids, here we are back to the types of diarrhea. If your diarrhea is from bile acid, yes, that would help bind the bile acid. What is so unfortunate about a lot of things like diarrhea, it's like trial and error, because a lot of times the diarrhea can be from multiple different sources. We see pretty good results with that medication. Like if you were having a lot of diarrhea, you started taking it and it got better, it probably is from bile acid because that's binding it. Sometimes people will say with bile acid, like their stools look kind of orangey. That's the only specific thing I've heard before. Not everybody says that, but I've heard people tell me that before. But yes, we use that medication here.
Got it. What about sugar substitutes like stevia, things like that? Are those bad for NET patients?
Mm-hmm. I'm a stickler, right? I worked in eating disorders. I don't think any food's bad or good. Well, I think a lot of foods are good, but I don't like to say bad because bad means it's hurting you, right?
Yeah.
Sugar substitutes. Stevia is a natural one. It's from a plant. I think it's a fine option to take. Some of the other ones, like sucralose or those are sugar alcohols. It's kind of like something that can't fully be digested in your gut, which is why there's no calories. But that can cause it's not natural and it's for your gut, so it's kind of like an added item. It can cause more diarrhea.
Do we even still use that? You remember like the old restaurants in the 80s and 90s that would have like the equal, the sweet and low,
Yep.
the red, like the pink, blue, and yellow packets. They were always.
I've seen that still. I have absolutely seen, not commonly, but I've seen it.
Now it's like sugar in the raw, stevia,
Brown sugar and stevia.
Yeah, exactly. Gosh, I just had like a flashback. That's funny.
A 90s flashback.
Totally, absolutely. Yeah, Raymond says I take 36,000 units of Creon with every meal. Best change to my treatment. So, hey.
Yeah, I will say, if I could give a PSA, right?
Sure.
If your bowel movements, if you have more than 1 to 2 bowel movements a day, you notice that they sometimes look oily, greasy, they float, you have a lot of gas after you eat a meal. These are signs that you need pancreatic enzymes. And sometimes you have these signs before you're having a lot of diarrhea, but it's really good to get on enzymes because or people will say, well, I just can't eat a lot of fat because I can't digest it. It would allow you to be able to eat that like salmon, like a healthy fat or something, without having issues. But also you'll absorb your fat soluble vitamins. So definitely talk to your provider.
Got it, got it. And folks, we had a couple of people chime in about the book that you just mentioned,
Yeah,
Sina, and Lackness added the link in
great.
the comments. So here's the link to Find the Food You Love book. So there you go. Told you we'd do the work for you. Eltaz says, thanks for your answer. It really helps to enhance the nutrition aspect in nets. I couldn't agree more. I'm so glad that you came today, because these are those questions that we don't often have specialists and experts on to discuss. But I
Yeah.
know they're so important because it's such a journey that impacts all different parts of your life, and there's not
Mhm.
just one way to attack it, for lack of a better word.
Yeah.
Um,
I recommend like reaching out if you ever have nutrition questions. Like most cancer centers have a dietitian. And like we are here to help. We make meal ideas for people, snack, based on what they need and what their goals are.
Is that something you're seeing more of? In the net space, we talk a lot about multidisciplinary teams. Um, is the role of the dietitian and nutritionist, I don't want to say becoming more important. It's always been more important, but bringing into the fold more these days. I think it is important that it is.
Mhm.
Are you seeing an increase in that role at these top centers?
I mean, we are blessed. We have 40 dietitians in our hospital, and there's six
Awesome.
that are just outpatient oncology, and that is part of your treatment plan. So
That's
you
awesome.
don't get to have a GI oncology surgery here without the dietitian seeing you. We sit with the surgeon, we go in together, we talk about post-op, pre-op stuff together. We make sure they heal and don't lose too much weight and lose muscle. We do physical exams to check on malnutrition. I can't speak to other facilities because I've worked here for a long time,
Yeah.
but we are very, I think it's the support is there. We've proven that, malnutrition is a huge risk.
Yeah, yeah, yeah. I think from my perspective, it seems like it is becoming more that way, which is so
Yeah.
great. I think there is this shift happening in medicine in general, quite
Yeah.
honestly, and so I love to see that. So yes, Carol asked the question about Creon. We've got just a few more minutes, so
Sure.
we'll get to a couple more. I take a high dosage for pancreatic insufficiency and severe weight loss. It is expensive, and I have frequent bowel movements after meals. I weigh about 102 pounds, and normal weight is 120. So,
Mhm.
any suggestions? Any advice for Carol?
Mhm. We, I'm sorry you're struggling with that, Carol. We would recommend, I don't know if you're taking like a product that would slow down absorption time as well. So once we kind of max out giving Creon to people and the diarrhea is better, but not at a normal level, that you're probably losing weight because you're not absorbing everything. We usually have the doctors work with the patient and we start Imodium or Lomotil. And there's kind of, depending on your doctor, some do it prophylactically, like before breakfast, lunch, dinner, bedtime. Some do it like kind of, if you have a diarrhea after meal, take one. If you have another, so I'd want you to work with your provider. But in rare cases, we've had some patients even use like tincture of opium. It sounds like you might need something in addition to the Creon or the Creon increase. So I don't know how many of those tabs you're taking, but you can go up. So your pancreas secretes hundreds of thousands of enzymes per meal, hundreds of thousands. So when you think of a 36,000 tab, it's a little bit of what your pancreas still has to do a lot of work.
Gotcha, gotcha. And from Gene, if you don't have a PNET, is Creon still suggested?
If you're having the symptoms, yes.
Got it. We've got 1 minute left. Final parting advice regarding nutrition or diet for NET patients?
Keep on going and don't stress out too much. Try to eat more healthy foods. Try to make sure you're having good absorption. Follow up with your provider if you want your vitamins checked. Advocate for yourself. Sometimes you have to ask. I'd like my vitamin D checked. I'd like my iron checked. Don't be afraid to say that.
Awesome. Thank you so much. We had multiple people in the comment section talking about how informative and great this session
Mhm.
was. I wholeheartedly agree. I appreciate you being here. It's very clear that you're an expert at this, but not only that, that you're passionate about it.
Yeah.
And I appreciate that so much and respect that so much. Thank you for your time today.
Yeah, you're welcome.
And thanks to you all at home. As always, we hope this program helped answer some of your questions. I'll reiterate, if you have follow-up questions, you can reach us at carcinoid.org or at lacnets.org/support line if you have further questions, or we will be back in June in just a couple of weeks. Thanks again to our presenting sponsor, Ipsen Biopharmaceuticals. We couldn't do the show without them. Finally, my name is Rain Bennett. I have been your host. Thank you for watching, and please join us next time on Luncheon with the Experts. Stay healthy, stay